AstraZeneca for a fireside chat with Maggie Lake on building climate-resilient health systems for NCDs.
Hi, everyone. So, Pam, as we jump in, I'm going to ask you to just repeat what you just said to me, because we were just chatting about work and jobs, and you hold many titles at AstraZeneca, but it was really interesting why you said that mattered. Just fill everyone in, because I think this is a fascinating point.
Yeah, so hi, everybody. Great to be here today. Pam Chang from AstraZeneca. So Maggie and I were just kind of having a casual conversation on the side there, and I said, really interesting to see how across different companies, how we do sustainability. Some, we have the CSO job as a standalone role. Some have it combined with operations role. So for me, I've got different day jobs. I'm the head of manufacturing, supply chain, procurement, and IT for AstraZeneca, and I'm also the CSO. And I find that it's such a privilege to be able to combine these roles, because it really allows us not to do sustainability as a side initiative or program. We literally build it into everything we do, from drug discovery to manufacturing to supplying to the patients. So it's pretty cool.
Which I think is so important, and I'm so happy to share that, because I think it does really bring home a lot of what we're saying has to happen now, that we're at this point where we recognize that this has to be early stage for everything. So we've been talking all about health.
Yes.
And we're going to talk focus a little bit. It's been brought up non-communicable diseases. Correct. So I think we understand the health impacts from climate. We are understanding it more after today. Talk to me a little bit about this area, because it seems like it's a little underappreciated.
Absolutely. So in Dubai last year at COP28, for the first time in history, we made the connection between climate crisis and human health. And I think that was such an amazing moment, because if you look at the statistics, there's data to prove that. There's 12 million people die, more than 12 million people die from pollution and extreme heat alone. And in last year's Lancet Countdown report, it's projected that if the temperature continued to rise versus the pre-industrial times, the number of deaths due to extreme heat will be increased by 370% in the future years. So it's there for us to see it. And we, in our industry, in the life science sector, we are in the business of making people healthy. And we see the rise of disease like respiratory, cardiovascular, and cancer. So it's hard to ignore that. It's happening. There's a direct link between non-communicable disease versus the climate crisis.
Yeah, and I was with someone yesterday who talked about a neighbor who had a generator blowing into their house, and neighbors, so air quality, you can't get more local than that. Absolutely. And all of them suffered from cancer. So it's that focus on those diseases that we don't maybe connect with climate, because it gets diagnosed for something else. So what do we have to do in order to prioritize this? What needs to be done? Where are we with the fight against that?
Maggie, that's a billion-dollar question, right? I mean,
and a very big one for the time we have.
Exactly. I'm watching time here. First of all, there's no magic bullet. There's no magical solution that's going to solve everything in a neat way. I think we think of it in two parts, right? The first part is, how do we decarbonize our end-to-end value chain, right? So, for example, in a healthcare sector, we contribute about 5% of global emissions. Now, you might think, Pam, it's 5%, it's not that high. It's high. It's bigger than the aviation sector. So it's a bit ironic where the healthcare industry is in the business of saving lives and making people healthy, but at the same time, we are contributing to the climate crisis, right? So I think the first order is, how do we stop contributing to the problem? How do we decarbonize? Absolute reduction. We're not talking about offsets or credits. We're talking about absolute reduction of decarbonization. How do we make sure we preserve nature and biodiversity? So I don't know if you guys know, but significant part, roughly 70 to 80% of the raw ingredient that goes into manufacturing of medicine, which is my day job, comes from nature. So how do we make sure we reduce that interdependency, that dependency on nature, stop contributing to the problem, and really restore and regenerate nature and biodiversity? So that's kind of the part one. Part two is really around health system resilience. If you look at health systems around the world today, significant number of them are under-resourced, overstretched, particularly post-COVID. Unfortunately, significant part of that burden are in the privileged populations and geographies like Africa, for example. It was estimated, WHO estimated the cost of climate-induced disease costs to the healthcare systems will reach about $4 billion per year by 2030. And guess what? 80% of it is shouldered by Africa countries. So really, we need to think about how do we reduce that healthcare system burden. And one of the things that we are being a champion of is first about prevention of non-communicable diseases. How do we help educate and raise that awareness and prevent these diseases? And then how do we make sure that there's early screening, early diagnostics, and early guideline-based treatment to keep patients out of hospitals, which is better for the patient, better for the healthcare system, and better for the environment.
Absolutely, and echoes with what Patty said. Not to mention, if you're spending all your money on treating people that are dying because of it, you have less money to invest earlier on in terms of making the transition and change. I want you to talk a little bit about Healthy Heart Africa, because the more specific we can be and give examples, people can take them away, maybe try to scale them, see if they work and apply to where you are. What's happening there? How do you feel about the progress? And do you think this is a lesson that others can take?
Yes, thank you for the question. So AstraZeneca has been really working on healthcare system resilience for a long, long time. We started Healthy Heart Africa as a program in 2014. And at the time, our goal was to really help with the burden of hypertension in Africa. And I'm super pleased to report that 9+ years later, we've actually conducted over 57 million blood pressure screening. We've identified over 11 million people with elevator readings, which means these are the folks that wouldn't have known they have hypertension potentially until the screening was made possible. We train over 11,000 healthcare workers in countries in Africa. So now, fast forward to 10 years later, what we are doing now is we are evolving Healthy Heart Africa to focus on those diseases that are climate crisis induced and have tremendous amount of burden on the local healthcare system. So we're going to focus forward on heart and kidney diseases. And we've got 4 very specific objectives. We want to educate and raise awareness about heart and kidney diseases. We want to train the healthcare professionals in Africa. We want to provide the opportunity for early screening, early diagnostics. So for example, for a kidney patient, disease patient, if you find it early and you can keep their disease in check and prevent them from progressing their disease to a severe state, that ended up them in the hospital doing weekly dialysis, for example, which, by the way, is one of the most carbon footprint heavy treatment in the health system, for example. So early screening, early detection is super important. And then lastly, on the last bucket is how do we generate evidence and science-based data to support better policy making and help increase our resilience of health systems. We've got a very ambitious goal. So we want to be operational in 9 African countries by the end of 2025. So we're getting to work on it.
That's terrific. And that's the kind of program that when you can scale is going to make a difference.
Huge.
Private-public partnerships, incredibly important in this area. How are you able to execute on a program like that? I would assume you need local stakeholders involved.
Absolutely. So we've got, at AstraZeneca, if I may expand this a little bit, we've pledged over $1 billion in our Ambition Zero carbon program. Effectively, our goal is we will reduce our scope 1 and 2 carbon emissions by 98%, absolute terms, by the end of 2026. I'm the head of operations. I feel the pressure, but good news is, as of end of last year, we've actually reduced scope 1 and 2 by 67% already. So we are on our way to that. We will have our scope 3 absolute emissions by 2030. We also pledged over $400 million in a program called AZ Forest. We are planting 200 million trees in 6 continents. And you might say, you know, it's about planting trees. Not really. It's above that because we are working with the local communities around nature, biodiversity, bringing jobs and livelihood to the local communities. coming to your point around public-private partnership, we couldn't have done any of that stuff without partnership. I would say in the space of climate crisis, it takes all of us to act. Initiatives like the Sustainable Market Initiative, the Healthcare Task Force, actually chaired by our CEO, Pascal Soriot, we're trying to mobilize the industry and engaging with governments, communities, and experts, and the private sector to ensure that we can actually move solutions at scale. So can't do this alone.
Yeah. We know that, and I love those examples because I do think it is exactly the blueprint for others who are looking to try to do that, especially when it comes to partnering with local communities, because that's what's needed. They need the help, but if you can come in and get that local knowledge, then it certainly guarantees more success. Absolutely. And thank you so much.
Thank you.
Appreciate it. Thanks all.
Thank you.